Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
But a mission to
Delivery of well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Stacy Smith-Foley. She is the medical director of the Breast Center in Carti. And Dr. Smith-Foley brings nearly 20 years of clinical experience as a dedicated breast imager practicing in Arkansas, Oklahoma, and South Carolina. Dr. Smith-Foley, thanks for being here today.
Thank you so much for having me again.
So we're talking about the new Mammography Quality Standards Act. Tell us what that even is. That's some big changes ahead.
Big changes ahead. So the Mammography Quality Standards Act was originally enacted in the 1980s to ensure that women were getting quality imaging, that the images, that they were standardized, that the interpretation of the images were standardized. And the MQSA guidelines and rules are mandated by the FDA and are administrated by the FDA. So most facilities will have an FDA inspection on an annual basis. The new rule that is being implemented September 10th is one where all women will be required to be notified of their breast density. Over the last probably 10 to 15 years, there has been a grassroots movement that went state by state. Each state enacted its own laws regarding breast density notification, but this is now a uniform federal guideline. It's been, really well thought out. The FDA made the announcement in the spring of 2023 and gave facilities over a year to implement it, but we will be required to implement it by September 10th.
So you mentioned breast density. Tell us what that is and what does an assessment look like?
So the density of the breast really is the internal composition, how much fatty tissue versus glandular elements. And there are 4 categories of breast density. There is fatty replaced, scattered, heterogeneously dense, and extremely dense. So with increasing breast density, there is increasing risk for developing breast cancer that is irrespective of family history. Also, in addition to there being increasing risk, there is a reduction in the sensitivity of mammography with increasing density. So you have 2 issues. One, there's an increased risk of developing breast cancer because you have this more dense tissue. Number 2, it's harder for us to find the cancer if it's present because the tissue could obscure a significant abnormality. It's important for women to know what their density is. It's not something that they can determine by feel. So when you're doing your clinical breast exam, you can't tell whether or not you have dense tissue. When you go and see your physician or your nurse practitioner and you have your annual well woman check and you get that clinical breast exam, they can't tell you whether or not you have dense tissue. It is the radiologist looking at the mammogram image that determines the percentage of fatty versus glandular tissue.
So in addition to certain requirements currently reviewed, these inspectors will also look for new items. What does that mean?
Well, so the new item is just this change in the letters that go to the patients. So we have elected, since we started the Breast Center at Carti here more than 5 years ago, we elected to notify our patients of their density. But now this is going to be a nationwide standardization of that notification. And they've been very conscientious about how they put this together. Every patient that has a mammogram gets a letter that says that things are okay and we'll see you back in a year, or that you need to come back for additional evaluation. But now the letters will include a new statement that very clearly states whether or not the woman is dense or whether she is not dense. And that really is the language that's in the letter. One of the issues with each state having its own laws were that there were different requirements in the letters and the verbiage varied. people could kind of come up with their own wording, but now we will all be required to have the same wording, and it's very clear. The letter will state, you are dense or you are not dense.
And accreditation failures are part of this new standard too. What does that mean when it says accreditation?
Well, the FDA comes in on an annual basis and they inspect each site for the quality of the images and the quality of the facility. They look at a facility's callback rate. They look to make sure that everything's being tracked. We have to track how many women we call back, what percentage of those women end up with a biopsy, what percentage of those biopsies end up being positive for breast cancer. You know, the mammogram isn't perfect, so there are cases where a breast cancer isn't identified on the mammogram, and the patient may return before her next mammogram with an interval cancer. So we have to track the failures as well. There are things that get tracked, like if the technologist has to repeat the images, you can only repeat the images a certain number of times. Our monitors have to be, we do quality assurance on a weekly basis to make sure that the monitors are up to snuff. So there are a lot of details that go into these FDA inspections. And if you're going to a facility that's accredited, be assured that the FDA has thoroughly inspected them to ensure your safety and the quality of your care.
And there's 3 accreditation attempts that a facility can try for if they fail one, or how does that work?
So yes, if you fail your first inspection, you can appeal or reapply. If you fail a second time, then you have to put in place measures that show that you have a quality improvement program. And then if you fail a third time, you would have to close the facility.
Equipment also must meet certain standards too.
Correct. Yes. And like they track everything. They track our licensure, our ongoing educational hours, not just for the physician, but also for the technologists. So it's a very, very detailed process. We have 4 locations. CARTA has 4 locations for breast imaging, and we go through an individual inspection for each location, not just the overall umbrella of CARTA. So we have already been through 3 of those inspections this year and clearly passed so far. We have another one coming up soon. We like to look at these accreditation inspections as an opportunity to clean the house, to shore up our processes, to make sure that we are doing everything the way they want it to be done.
And is there a change with personnel records too? Is that also a part of this?
Well, so they do look at the personnel. They're very specific about, you have to keep records from the time a technologist first gets her licensure and what kind of registries or certifications they have obtained. And are they continuing to meet continuing education? And all of these things are kept in giant binders. So the day that you have inspection, your lead technologist or your mammography manager holes up in a room with like 20 binders, and they go through all of it with a fine-tooth comb.
So this is a positive step. This is a big deal for.
Yeah, I think it's a great step for patients. I think that it's going to be standardized across the nation. Women will have a more similar experience. When they get that letter, it's going to clearly tell them that they are dense or that they are not dense. So they won't have to wonder anymore. Different states that did not have a requirement that the patient be notified. Some of the states just said that the physician was to be notified. But in this new rule for the FDA and rolling out the new requirement, it will be clearly stated in the report that goes to the referring provider. And now it will also be stated clearly in the letter to the patient that we refer to as the lay letter.
So is that notification the only impact that you expect for providers, or is there something that healthcare providers should also look for that could impact them?
Well, I think there's been a lot of press around this. So healthcare providers may look for more discussions with their savvy female patients who are hearing these buzzwords about breast density and they're wondering, what does this mean for me? I think the important thing for referring providers to know is that dense breast tissue is not a terrifying thing. It's not a horrible medical condition. It's just like eye color. It is the composition of the breast at this moment in time, in this snapshot. And it can change. The breast density can change with weight gain, with weight loss, with hormonal influence, with pregnancy, with breastfeeding, with menopause. So it's not static. We reassess the density every time a woman has a mammogram. We actually here at Carti, we have a software package that uses AI, and it gives us an estimated breast density. So we have a quantified measurement. So it's not just my opinion, although I will say the vast majority of facilities across the nation, it's the radiologist's opinion as to what the density is. We appreciate having this tool as a way to measure it, and we can use that to communicate with our patients. You know, some patients come in saying, oh, I've always been told that I'm dense, but because density is not static, it changes over time. They may not be dense now after menopause or, after a weight gain, or they may never have been dense and now they've lost a significant amount of weight and they are dense now.
Dr. Smith-Foley, thank you for talking about this potentially life-saving change for Arkansas women. I appreciate you being here today. Thank you.
You're welcome.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.